All right. Can you speak about the importance of involving the family in the care plan and how you work with them? So, I started off with this by saying that when we deal with somebody with dementia, it is we actually don't think of it as just an individual. We're thinking of it as the family because dementia affects the family, the entire family in a lot of ways. It is not just affecting one individual because what happens in dementia is there is a slow kind of cognitive decline that happens in the person along with various other symptoms. So while in some kinds of dementia the cognitive decline may not be that apparent, the person is still able to understand things, able to talk properly, or able to comprehend things well enough. But their general level ability to do things the way that they used to before, make decisions, be able to problem solve, be able to execute complex actions in life, all of these generally go down in all kinds of dementia. So, apart from this, if it is a kind of dementia, and I'm not going into the types of dementia now, that'll have to be a different interview, a different talk. But depending on the type of dementia, the symptoms also vary. So there could be a kind of, there are kinds of dementia where the person may have speech loss over time, and if that's the case, then they're just not able to communicate what they would like to do, or the family is struggling to talk to them or find out or help them express what they would like and what they wouldn't like. Or there could be in other kinds of dementia, there are mobility related issues. The person is not able to walk around or do as much independently like they used to before because of their mobility. Or in some cases, some kinds of dementia like Alzheimer's, which very very heavily tells upon the cognition of the person. There are memory lapses, there are difficulties in making any kind of decisions, and over time it's really bad. The memory is so bad that the person starts to forget their own name, and towards the end it's a complete blank slate, right? So when somebody is struggling with a condition like this, one can only imagine what the family around them is going through, what the family around them is having to do to take care of a person like this, because the person is becoming more and more dependent day by day, right? So therefore, the family's involvement in the process of care for somebody with dementia is absolutely imperative. We not only handhold the family through every single hiccup. It could be that my father has not slept today, he's not slept the last 3 4 nights, what do I do? Or he's just not been sleeping, what should I do? Or my mother's now suddenly in the morning started getting aggressive and she's hitting us, or she's verbally abusing people who come near us, what do we do? Or it could be that my husband is not able to get up, and today for instance in the morning he was not able to get out of bed on his own. What is wrong? So there may be multiple issues like this that come up for the family on a day to day basis, which we as psychologists help them navigate and help them find interventions and behavioral solutions for, because these are not things that medicines can help with. So this is one way in which we are constantly interacting with the family. The second is the grief, that the family is feeling, especially if it's a spouse, and especially if it's a well loved spouse. If it is a relationship that has been beautiful and that has had a lot of love over time, then the person who's left behind, or who is still cognitively able and is able to comprehend the depth of losing their loved one, is going through a minute by minute grief, where it's in fact termed, Alzheimer's has been termed the long goodbye, because it's not a goodbye you're saying in one day or in a month or in 2 months, which is usually the case with other people who are leaving us through death. We either have time to acclimatize to it, a few months of time or a couple of years, or it is sudden and they've gone away and they've left us. But for somebody who's dealing with the loss of a loved one due to dementia, it's a long drawn process over several years, and they are losing bits and pieces of them one by one. So often it is a very very difficult process for the family, for the loved ones who are left behind. And therefore this hand holding to help them through this, to navigate this process of grief, and therefore counseling to a large extent. A lot of therapy sessions with the family themselves is something that we we have to help with. Now, in the care plan itself, now coming to the actual point of what the question was, in the care plan itself, the family plays a very vital role, because the care plan would involve bringing in interventions, like I said, in maybe the diet, the amount of exercise, in the kind of activities that the person with dementia is doing through the day, in the amount of socialization they're getting. Like, for instance, one of the families I work with, where the gentleman suffers from dementia, his wife has to ensure that they make plans to meet people at least once or twice a week, because he's craving for social company all the time, and he can't do it on his own. He can't be let out to go and meet his friends on his own. He's not cognitively able anymore to do that. So the wife has to do it. And if the wife was not motivated enough to do it year after year after year, it would really be something else. And if she's not, doesn't get support from us as psychologists to do that, it would be very detrimental to the person with dementia, because he's not getting the required interventions that they need, right? So the family, in a nutshell, it plays the most pivotal part. If the person with dementia is actually living with the family and they're not in a care home, then the family plays the most pivotal part. If the person with dementia is in a care home, then of course it's a totally different matter altogether.